In this video, we're going to talk about drawing up medications from both an ampule and a vial. So first, we're going to look at drawing up medications from a vial. So a vial is this little thing. It's glass and it has like a plastic top. We're going to need to grab a needle. We're going to pick our needle based on what we're administering and how we're administering it. We're going to pay attention to the volume of the needle as well as the length of the needle. So for my needle, for my syringe, I have a pre-connected one. It has the needle and the syringe on there. Whenever you have these that are pre-connected, it is important to go ahead and twist it to make sure it's tight. Otherwise, you'll end up drawing up air. So I'm going to go ahead and draw up 1 ml because that's how much medication I'm going to draw up from the vial. And I'm going to pop my cap. This is already sterile because it had the cap on it. If there's any thought that I contaminated it, then I would scrub the hub with alcohol. I'm going to inject the air into the vial, and I'm going to turn them up. And I want to try to get that needle as low, as far down into that vial, as close to the end as possible to get every bit of that fluid. And you can see it just comes real nice and easy where I put air in there. And once it's all out, I'm going to pop that needle out. Now, depending on how you're administering this, whether it's an intramuscular injection, you may need your needle. And if you need the needle and you haven't used it to stick a patient yet, you can do the swoop technique or where you take it and you have your cap here and you kind of swoop that in and click it. If you do not need your needle, then you shouldn't risk that. And if the needle has already been used on a patient, it is not okay to do that technique. Okay. So if you don't need your needle, let's say I'm giving this IV, I'm not going to need the needle, so I can just deploy my safety, and that will prevent my needle from being able to stick me. Now I just need to go ahead and ensure that I get all the bubbles out and the air. So I have some air in there, so I'm going to push that to the top, and you can see that bubble right there. I can kind of flick it and that bubble comes out. If let's say that you have a hard time, you have a bunch of little bubbles, you can gently tap it with something like your pen or a flush to get those out. And then just make sure you have your fluid all the way to the top, and then we're going to check our dose to make sure we have 1 ml. And that's as easy as it can be. And now let's look at drawing up medication from the ampule. So an ampule is a all glass medication container. And you can see that we have glass up here instead of the little pop tab. And this is what we're actually breaking off in order to access the medication. So when you are using an ampule, you do need a different type of needle. You need a filter needle. So a filter needle is basically a blunt tip needle that allows it filters basically out particles and prevents anything from getting in the syringe that you're going to inject the medicine. So particularly with an ampule, when we break this, we're worried about glass particles getting in the fluid and then that being administered to the patient. The filter needle should never be used to inject medication. So if your patient, if you're giving them something from an ampule and they have an IM injection, you need to change your needle. You cannot give an IM injection with the filter needle, okay? When you are opening the ampule, the first thing you need to do is you need to make sure that all the fluid is out of the top. So I don't know if you've seen, like the fluid can go there. So this one very easily is when I turn it. This one's a little harder. So when I turn it, I don't know if you can see, but there is still fluid in there. If you're ever unsure, just tap it. You see it? And you want to get all the fluid out of the top up here because we want it all down here because we're going to break this part off. Okay. You can use either one of these little guys. So these are ampule breakers, and they basically, that part just slips over around that, and then we're going to break it away from us. And the top of the part goes in there, and we toss that into the sharps, and then we can draw up the medication. Another way that you can do it if you don't have one of these little ampule breakers is you can just take an alcohol swab or 2x2s and you can wrap it around it. If you're using alcohol, don't open it, leave it closed. Wrap it around and always break it away from you. And then this goes in the sharps. Now, when you're drawing up medication from your ampule, you do not need to have air in the syringe. Okay, so the first thing I'm going to do is I pulled my needle out. I am going to go ahead and put my filter needle on, right, because I have an ampule. So I'm going to switch that out if I can get it open. This way. If I was doing an IM injection, I could save this if I kept it sterile. So I can go ahead and put my filter needle on. I don't need to draw up the air. I'm doing 2 mLs, so I can pull it up. And then this will go in the sharps and get all my air out. My air out. Now, for this needle, I can go ahead and do the, well, see, I dropped it. So that's okay. I can put this directly in my sharps, which I'm going to do so I don't stick myself. And then I can go ahead and put my other needle back on if I need to do an IM injection. Okay. All right, and that's as easy as that.